Good afternoon, and thank you for joining us. I'm Bill Blackburn, Mayor of Kerrville. The City of Kerrville, Kerr County, Peterson Health, and our educational partners at the Kerrville Independent School District and Schreiner University wanted to take this opportunity to keep our citizens up to date on the latest COVID-19 developments and their impact on us locally. I know all of us wish we were not having to deal with the threat of the coronavirus and the resulting COVID-19 illness, but we are. The fact that we are speaking to you from a room with just 10 people in it shows how seriously we are taking the Texas governor's mandate limiting group gatherings to that number. The COVID-19 crisis continues to grow in the United States. While we still do not have a confirmed case in Kerrville, it is important to note that screening for the virus is happening locally. In an effort to support the Peterson Regional Medical Center in its frontline battle with COVID-19 and to continue an additional screening venue locally, Peterson is announcing this afternoon the opening of a mobile outreach clinic beginning Monday at the Hill Country Youth Event Center. Monday at the Hill Country Youth Event Center. I'm sure Mr. Edmondson will say more about that later. This clinic, which Peterson CEO Corey Edmondson will be talking more about in the next few minutes, will be greatly aided in this response of screening, in the screening efforts. We will not be calling today for a move to shelter in place or a shutdown or a work stoppage locally. We continue to follow guidance from the state of Texas and Governor Abbott, who has not issued a statewide order regarding shelter in place. Obviously, we reserve the right to do so should our local situation change dramatically in the coming days and weeks, but it is our sincere hope that we can avoid that if possible. Regardless of what happens with testing results, I urge all of us to stay vigilant while also seeking to remain calm, to continue following the CDC guidelines for cleanliness and social distancing, and most importantly, watch out for your own health and the health of your family, friends, and neighbors. For parents and other caregivers, remember the instruction on airplane flights when parents are told to put their mask on first in case of an emergency, and then the child. Take care of yourself. We have had tremendous support from our citizens, local businesses, grocery stores, restaurants, and more in our efforts to contain COVID-19. Working together, we will get through this, and we can grow stronger through it. To our local businesses that have been affected by the response to this illness, local citizens, banks, city, county, state, and federal government are seeking ways to be of help. We want hurting businesses to be healthy again. Finally, I want to tell you that the healthcare community here, as well as the city, the county, the Kerrville School District, KPUB, Schreiner University, law enforcement, and the emergency management personnel are all alert and involved in prevention and preparation. In fact, one of the best things we have going for us right now is the cooperation and collaboration of the community leadership. Now, let me turn this over to the CEO of Peterson Health, Corey Edmondson.
Good afternoon. Name is Corey Edmondson. I'm the President and CEO of Peterson Health. I'd like to take a few minutes and update you on COVID-19 here in Kerr County to address some of the most common questions and concerns we hear often from our community and to announce some new resources Peterson Health has initiated for our medical and general community. First of all, today, as of today, March 27th, there have been no confirmed cases of COVID-19 in Kerrville or Kerr County. As I've said from the beginning, it's not a matter if, it's when and when we receive word from the Texas Department of State Health Services, we will immediately inform our employees, physicians, our medical staff everywhere, our valued healthcare partners, and the general public. We have from the beginning kept all of the above in the communication loop. Peterson Health is seeing the rise of the number of people being screened daily. So let me take a minute and clarify the difference between screening and testing. I think there's some confusion in the community about what that means and what is happening at Peterson or around the state or around the country. Specifically, Peterson Regional Medical Center and physicians' offices screen individuals with appropriate symptoms that meet the CDC and the Texas Department of State Health Services guidelines, which have reportedly been mild to severe respiratory illnesses with symptoms of fever, cough, and shortness of breath. This preliminary work determines if you meet the criteria to be tested. If so, specimens via nasal swab are collected at the hospital or physician's offices and then sent to the Texas Department of State Health Services or commercial labs to be tested. The results are reported within about 24 to 48 hours, though the wait time is increasing as more and more tests are being collected. If you feel you have symptoms, call your primary care provider or the Texas Department of State Health Services, Region 8, for questions and to know what to do. Peterson Health can provide a number for you by calling our COVID hotline by calling 896-4200. That's 896-4200. Our hotline hours have been expanded as of today by popular demand. You can now call between 6 a.m. and midnight, 7 days a week. We understand there's an unsettling time, and many of you may be wondering what you should do if you think you may have been exposed to some symptoms of somebody who has COVID-19. The CDC recommends the following steps to care for yourself and to help protect other people in your home and community. 1, stay at home except to get medical care. Do not visit public areas. Stay in touch with your doctor. Call before you get medical care. Many medical visits can be done by phone or telemedicine, which, by the way, Peterson Medical Associates will be having very soon to offer to our community and those who are part of Peterson Medical Associates. Stay away from others as much as possible. Isolate yourself in a specific area of your home. If possible, use a separate bathroom if available. One of the biggest questions we've been asked is, if I have COVID-19 or have been exposed to someone with COVID-19, when is it safe to go back out into the public or return to work? And again, according to CDC, people with COVID-19 who have stayed at home or isolated can stop home isolation under the following conditions. If you have not had a test to determine if you are still contagious, you can leave home after these things have happened. You have had no fever for at least 72 hours. That is 3 full days without a fever, without the use of medication that reduces fever, and other symptoms have improved. For example, your cough or shortness of breath has improved, and at least 7 days have passed since your symptoms first appeared. If you have been tested to determine if you are still contagious, you can leave home after these 3 things have happened. You no longer have a fever, which without the use of medication of reducing with the fever, and other symptoms have improved. For example, your cough, shortness of breath has improved, and you have received 2 negative tests in a row, 24 hours apart. Your doctor will follow the CDC guidelines. I can tell the community and I can tell people all day long of what these issues are and when you need to do what. It gets confusing often because of this time. People's emotions sometimes will lock down and you can't retain all of that. I highly recommend you always go to the CDC website or the Texas Department of State Health Services website and educate and be informed personally. But in all of these cases, follow guidance from your healthcare provider and local department. The decision to stop home isolation should be made in consultation with your healthcare provider and state and local health departments. Proudly, Peterson Health, the City of Kerrville, Kerr County, KISD, Shriner, and all those involved continue to meet the healthcare needs of our patients, employees, and community. In response to the growing needs of our community, Peterson Health is creating the Peterson Outreach Clinic that the mayor alluded to. Beginning Monday, March 30th, drive-in screenings for the COVID-19 will be offered at 7 days a week from 9 to 3:30 at the Hill Country Youth Event Center. This new service is by appointment only, and I preface that, by appointment only, and is designated for people who are experiencing respiratory symptoms as outlined by the CDC. We will provide the public with Peterson Outreach Hotline in a press release or on our website by this afternoon. The Hill Country Youth Event Center is the perfect facility to set up a clinic, and as it helps remove the symptomatic people away from the hospital and medical offices like social distancing, where we are treating current patients with other healthcare needs. Again, we thank the county for making this available to us and for all the support from our city and county partners. I believe there's a silver lining for all of us to learn from COVID-19. Peterson Health is learning that crises like this can bring the best in people and organizations. In this case, COVID-19 has created one of the strongest partnerships in the region at Peterson, if not in the state. The work that we have done together is unprecedented, and the ideas and solutions that Peterson Health team came up with each and every day amazes me personally. I'm inspired by our leadership. Everyone is working around the clock to create resources, to educate, to communicate, to initiate new programs, to extend services or hours, and to step out of their position in order to help where needed without being asked. We remain positive and calm and continue to meet our mission of providing exceptional, compassionate, patient-centered care inside and out, and do whatever it takes to support the needs of our community. Together, all of us are truly elevating health. I want to leave you with a couple of thoughts from a personal perspective that really inspire me, that I try to aspire to, and I think our organization does as well. It's by Charles Swindoll. It's a quote that ends with, "Life is 10% of what happens to us and 90% of how we respond to it." We are all hit with the COVID-19. How we are responding to it as an individual or as a community is vitally important, whether we succeed or fail. I also ask for your grace as a community to the community leaders, to each other, as none of us are going to be perfect in what we do, but we are absolutely doing our best. And together as a community, we should be able to succeed in whatever faces us as an organization, as individuals, and as a community. That being said, I will turn this over to county and judge. Okay, or mayor.
Yeah.
Okay.
We have physicians and other professionals here to respond to questions. I'm going to go ahead and tell you who they are so that it may help you in terms of what question you have. Dr. Matt Blanton from Peterson Health, he's the Chief Medical Officer. Chief Danny Smith, head of the fire department here and working very much involved in the response to this. City Manager Mark McDaniel. Dub Thomas, who is the Emergency Management Coordinator for the county. Mark Faust, Dr. Mark Faust, who is the Superintendent of KISD. County Judge Rob Kelly, you just heard from Corey Edmondson. And also from the head of Schreiner University, just a talented guy that you could answer all of our questions, I think. Charlie, we look forward to hearing from you as well. All right. Do we have questions?
Yes, sir. Mayor, we do. We're going to open up the questions, as you said, now from the press. We have 2 callers. Each caller will get 2 questions, and then we'll go to the next caller, and we will repeat that process as long as necessary. So I think our first caller, we're going to take them in the order they came in, is Tammy Prout from the Hill Country Community Journal. Tammy, can you hear me?
Yes, thank you so much. We get calls all the time about how there is or is not a way to tell if there's COVID-19 in the community because we're not testing. You've answered that question about test and let the community know that we have been testing all along. And to date, there have been 12 tests that have been done. So my question is, on the mobile testing unit, why was that necessary? Was it fines? Was it increased need? Was it to separate patients from healthcare workers? Why the mobile testing center?
Sure, thanks, Tammy. We wanted to set up the mobile testing center, one, because we're starting to see a need for people to be screened. We're seeing a little bit of bump in our volume at the urgent care center for respiratory and just monitoring that. Again, those who meet the qualifications, we do send those specimens off to get tested. But we do a lot of screening and have been doing a lot of screening and monitoring. Again, I want to make sure that the community understands the difference between screening and testing. If someone qualifies under the CDC guidelines and we call the Texas Department of State Health Services and believe that this patient should be tested, we get their approval. We don't have control over whether they get tested or not. That is up to the state to be able to determine if they meet that criteria, and then they will go and we will send specimens off to get tested. We've been testing from day one, but we are limited and not in control of that from our perspective. So, does that answer your question, Tammy?
It does. And my second question, I think, could be helpful in some ways, does have so much access to social media and different reports, and the word presumptive positive keeps popping up, and we act like we know what it is. But according to Judge Kelly yesterday, there is some confusion, and I had another interview today. I was wondering if you could explain presumptive positive and why that's no longer something that we use in terms of.
Yeah. Okay, thank you for your question, Tammy. I believe the term presumptive positive is no longer being used because those tests that are sent off to either private labs or the state labs, if they tested positive, at that time they were considered presumptive positive until they were confirmed by the CDC. And the CDC no longer is considering them presumptive anymore. They're considering them a final determination of positive. That answer your question?
Yes, it does. I just think it was confusing, and I wanted to get it clarified. Thank you.
You're welcome.
Okay, and our next caller is Louis Amistoy from the Kerrville Daily Times. Louis, can you hear us?
Yes. The Hill Country Memorial Hospital, put out a plea to Gillespie County to put a shelter in place. Bill, Judge Kelly, why have you decided not to take that course of action?
As I mentioned, that is an action we may take. But at this point, where we have no confirmed cases, it does not make sense to take that step because that has all kinds of ramifications if we go that direction, negative ramifications. However, if we see that is clearly needed to protect life and health, we will do it. So it remains as an option.
Sure.
Follow up on that question. The surrounding areas are taking that approach. Don't you feel that's an abundance of caution, even if it has the negative ramifications, if this thing got loose? And Hill Country Memorial painted a pretty grim picture of what it would do to their hospital should there be no kind of shelter-in-place order.
Right. I will just say to you that I am very carefully listening to people who have experience in this and are watching things very carefully, and I would be very willing to go to shelter-in-place if it really is needed. And I think the county judge wanted to respond.
Sure.
Sure. Frankly, we don't think it's absolutely necessary yet. The crisis that we're dealing with is a health crisis for sure, but it's also an economic crisis. And once we issue a settle-in-place order, that will shut down commerce virtually completely at that point. And we have a lot of people in this county that do not have benefits, they're independent. It's more like a chuck and a truck, and they have no safety net whatsoever. So the minute we shut it down, their income stream stops, and we don't know for how long. and we don't have any positives. So at this point, we've tried to keep everything going just like it is and monitor the situation. But if it changes, we're prepared to make the change on the spot. Anything else?
I think we're back to Tammy. Tammy, did you have any more questions? Did we lose her? All right, Lewis, can you hear me? Let me check and see.
You
I would like to call on a couple of people.
Let me add something.
We've got Tammy coming.
Well, I forgot, as part of, just as a supplement to my answer, when we were working on our little scare at the courthouse, fortunately, was able to visit with Corey over at Peterson. And some of the information that I shared with him was information that he didn't have with the number of people that we've actually been monitoring through DSHS. And it's been remarkable that we've been monitoring people for over a week and still haven't had any positives at all. So we view that as kind of an encouraging sign. We don't know if what can happen, but that was something that was encouraging to us at least. So that's one of the things I'm looking at here is we have been monitoring people for some time, and everything has been successful.
Okay.
In the absence of another question,
Well, I think we may have them back now. Tammy, can you hear us now?
Yes.
Okay, did you have another question?
Yes, I was going to ask Corey on the Corey Edmondson with Peterson Health on the staffing situation at the hospital. I know that he said that he had child care. He was working with the Croc Center to make sure that the staffing had child care, but also the governor's waiver on nursing students to allow them to be able to assist. Is that something that's helpful to him, or is he having any trouble with staffing at this point?
So the question is about what staffing and how are we working with the governor's stance on nursing and licensing and things of that nature, being able to deploy nurses more expediently. We are working within our own hospital where we have reduced services or we've had to cut back, for example, elective surgeries. We have surgery nurses and other staff who can be redeployed within the hospital and cross-trained, and that's what we're doing at this given point in time. We're anticipating the potential for a surge to happen, and if that's the case, we've got staff that's going to be able to double up and help out in case of a surge. We're also working with Schreiner University and their plan and their nursing program and students to deploy and work with. We have several of those students at the hospital in training. We've also had retired nurses who've reached out to us and are willing to work also in a capacity if that's needed. Does that answer your question, Tammy?
It does. Thank you so much. And the next question is for the mayor. Each day we go out, we're seeing a lot of businesses and individuals and workers that are struggling, which they understand why, but I'm wondering if there is a need that is increasing that you know of, or is there that is being unmet that maybe we can address?
Basically, you're asking, am I seeing more people in need or?
Of any certain item, is there needs of food? Is there need for?
I think she's asking
Yeah.
about
The
support
city
systems.
manager can probably take that better, Tammy.
Hello, Tammy. Yes, we are monitoring that pretty closely. I've even asked the council to step up and help with that, and they've willingly done so. We're checking with the food banks on a regular basis or the pantries to see how they're doing. They right now have a lot of folks coming through, and they have food. They are concerned about what will happen if this goes on, and so we're looking at how do we deal with that longer term in working with the food banks. And the issue is really transportation of food, not a lack of food, so we're addressing that. And then, we are hearing from businesses or individuals where it is tough, and individuals that have been laid off. And I'm very pleased that Congress is getting this bill through to final passage, and I hope the president signs it soon to provide some immediate relief, whether that's in the form of payroll taxes or additional unemployment benefits. and what have you. And then and lastly, I would say that the mayor has been talking with some of our business leaders about things that we might want to approach and do locally. And I have been proud of the way that our Chamber of Commerce has stepped up and made sure that people know how to get access to many different things. And then just yesterday in our weekly executive discussion, we had a call, or not a call, but a discussion about what's next on restoration. You know, once we get past the emergency, what about restoration? And so we're already thinking down the road in terms of what needs to be done to provide that. So yes, we are seeing additional need, and we are trying to make sure that that's being met.
You make a quick response to that, and then I'd like to ask Dr. McCormick to share with us a little bit about what's happening at Shriner, and then Dr. Faust about where KISD is at this point. I have been pleased and encouraged by the number of people who are trying to find ways to help local businesses. Restaurants certainly, but other businesses as well. How do we give them business? How do we help them make it through this? So I'm seeing that we've got businesses that are hurting, and then we've got the individuals who've been laid off who are hurting. And how we address both of those is, I believe, critical to the future of this community. Fortunately, there are people stepping up, there are people helping, and I think what's been passed in Washington is going to be of help as well. But Dr. McCormick, could you bring us up to date on Shriner?
Thank you, Mr. Mayor. And reflecting on Corey's quote, it seems so appropriate to all of our organizations and the individuals within those organizations and this larger community. It's been challenging at Shriner. We moved to an all-virtual learning environment on Monday of this week. And so our history and our preference has been to deliver courses in face-to-face learning environments. And literally overnight, our extraordinary faculty and staff and students have stood up all of these new virtual learning spaces. So courses are being done at a distance, as well as all of the services we traditionally provide at a residential campus. That includes everything from exercise classes to lectures to tutoring and counseling services as well. The campus is largely closed down now. We are still open for business, but we've limited access to buildings and grounds as everyone practices social distancing. So we know our colleagues in the Kerrville Independent School District have wrestled through some of these same challenges, but I think Dr. Faust and I would both agree that all of these constituents of our organizations have just responded to it in extraordinary ways.
Yes, sir. Thank you, Dr. McCormick. I would agree. We have incredible folks in Kerrville. I've been blessed and amazed by the cooperation and collaboration of our teachers, our leaders, our paraprofessionals, our food services folks, our maintenance and operations, custodians have worked together seamlessly, and we're doing everything we can to serve the students of this community. This week, our food services started our community feed program. We got an update midway through the week that initially we were told parents had to have their students with them to pick up meals, but those regulations were relaxed, and if students are not with their parents can still come get the meals. We're approaching 5,000 meals served to the community this week. That's breakfast and lunch. So what a blessing that we're able to help in that way. I would also say that our teachers have been meeting and working incredibly hard this week to transition to these brand new systems of online learning. This week we had a resource of learning from home, which was really just set aside for our parents to work with their students this week, and it was a continuing education resource. We will transition formally away from what we called a temporary learning from home continuing education to virtual KISD. That will begin Monday, March 30th. Virtual KISD for our early childhood students through fourth grade, we'll be using an app called Seesaw, and for our 5th through our 12th graders, we'll be using Office 365 to provide instruction and learning. This is what we are going to start calling flexible learning is one way to describe it. Virtual learning is flexible in that where, when, and how students learn will be based on their needs and their time and their availability. And our teachers are going to be communicating directly with their students to make sure that they get the support and the resources they need to continue their learning. So we're going to passionately and aggressively pursue completely diminishing or eliminating learning gaps that could arise because of this crisis. So we're just grateful to the incredible staff. One last thing I would say, you can look to the skies between 8 p.m. and 9 p.m. each evening. At Antler Stadium, we're going to turn on the lights as a symbol of hope for our community, that we are all in this together, and we will support one another and make it through this crisis. So just know that that's something we'll do throughout the duration of our school closure. So thank you.
Mr. Mayor, I think we still have questions.
Oh, you do?
Yes, sir.
Okay.
And I think we're back to Lewis with the Daily Times. Lewis, are you there?
Yeah, I keep seeing this number about 12 people who have been tested. Is that accurate? Who keeps saying that? Who said that? Or 12 people?
Yeah, so the number of people who've officially been tested evolves. The exact number and us keeping track of that is it falls within the guidelines, and 12 is probably around the right number, but that evolves in day to day. So I can't be very specific on that, but I can tell you that we are testing often based on the Texas Department of State Health Services guidelines.
Chief Smith said the other day that he was hoping that there was going to be a stand-up, a testing center. But what you're talking about really is a screening facility, not a place where we can get results more quickly. And just to follow up part of that too, for Corey and anyone else, obviously we know firsthand what's happening here. We're hearing anywhere from 5 to 7 days for results, up to 10 days for results. Any explanation on why the testing takes so long to complete?
I am going to call on my Chief Medical Officer, Mac Blanton, to address why the duration is changing. So, Dr. Mac Blanton, please.
Yeah, thank you. The testing is sent either to a public health lab or to a commercial lab. And as the testing increases locally and across the state and across the nation, those labs' capacities are going to be more and more stressed there. So the time for the testing is increasing a little bit, and it's purely due to the demand against the capacity of the lab's testing capability. There are tests that are coming out that will have a much quicker turnaround, and we're looking forward to having those, but currently it's either commercial labs or public health labs, and I think the duration is purely related to demand versus capacity of the lab to meet that demand as it increases. Yep.
Okay. I'm sorry, we'll go back to Tammy. Did you have any more questions?
I do. On the testing results, could you explain the process? It's my understanding that the city or the CDC is only notified of a positive test result, but the community wouldn't know the results of all 12, right? Only positive results?
That's right. As we test, if they come back negative, they're negative. There's nothing to report. We communicate with the patient and what they need to know. So we'll report when a positive comes. So, Dr. Blanton.
Yeah.
You can come on up.
Yeah, that's correct. We are required to report all tests, whether they're positive or negative, to the State Department of Health. So all the tests, whether they're positive or negative, are actually reported to the State Department of Health. That's a requirement that we have.
Okay. Tammy, did you have any more questions?
And only one this is my last one, but only one for Dr. Faust. they've had to undergo quite a bit of change and do it quickly. But they also had assistance from the Kerrville Public School Foundation on laptop computers, and they were also offering Wi-Fi hotspots. And I thought maybe you might want to say how that's working, why that was needed, and how they're helping the students who don't have access to laptop computers or Wi-Fi.
Yes, ma'am. So before spring break, we were afraid something like this might happen at some point. We gave a student survey and got as much information as we could on the technology that students had available in their homes and if they did not have access to the internet. That survey identified that we had a little under 300 students that said they did not have access to internet at home, and a much larger number of students that didn't have access to devices. That grant from KPSF was incredibly helpful to help us make a purchase of additional computers, laptops basically, that we're going to get out to our students. We have roughly 1,100 devices between iPads and laptops that we are distributing to our students. We have ordered 400 mobile hotspots, or a cellular hotspot that families will be able to have in their home. So we'll take care of those first 300 identified and any others that come up. We haven't received those yet, and we don't have a delivery date. I'm supposed to get an update on the delivery date of those 400 hotspots. As you can imagine, we have been asked to be patient about the delivery of any additional technology because the entire country has placed orders for items like that. As soon as we get those items in our possession, we'll immediately be contacting our students directly that were identified by the survey, and we will be providing them with that technology. Does that help?
Yes, thank you.
Thank you, Tammy, and just to be equitable, we're going to take 2 more questions from Lewis, and then we'll be done.
Okay.
Okay. Lewis, do you have more questions?
One last question. President Trump wants to have the country reopened by Easter. Does anybody think that's reasonable or realistic?
I'll let the county judge answer that.
I don't know.
I don't think we know. And particularly as you look around the country at how this thing is spreading, that seems remote, but I wish it were true. I want to thank everyone who participated today and for all of our citizens who are watching. We will continue to keep you informed of the latest developments through the media, our various websites and Facebook pages, or you can call the city's COVID-19 hotline at 258-1111, 258-1111. This concludes our press conference, except for one more thing. I ask for the prayers of the people of this community and this county for what we're facing in regard to this virus and the response to it and care for anyone who is diagnosed as having COVID-19, for the health workers, law enforcement, first responders who would be working with those individuals, and the families involved as well. So this concludes our press conference. Thank you.